Greetings, Integra Therapy family. Hope you're well. Wherever you are, in your working environments, hoping you're staying connected to your body, the people around you, your immediate, your external environments, and finding resourceful and helpful ways to keep you healthy and well. If you're joining me for the first time, my name is Andrea Wright from Integra Therapy, and I'm producing a series of videos to help you stay well, be mindful of your body, and to really begin to address any issues that you might have come across or might experience. Today we are going to work with an advanced exercise that's really helpful for working into the shoulder region, an area of the body that's often implicated in terms of postural concerns. When we roll into posture, the shoulders come forward. This is an advanced strategy to help open up the front of the shoulders. It's also really good if you have anterior shoulder pain or any other dysfunction that involves the front of the shoulder or anything coming down into the bicep area. This is a very advanced exercise. If you're not sure about it, then please do get in contact with me, Andrea, at integratherapy.co.uk. So let's begin, as we always do, finding a comfortable chair. We're going to have our feet planted firmly on the ground, our buttocks nicely nestled into the back of the chair, but our back is slightly away. We're going to do the dance of the shoulders. This is really something to allow you, if you're following me in this video, then it's a way just to warm up. You can find your own warm up, but really the point of this is that you find some connection, that you connect with your breath, that you're mindful of how you're feeling right now. So inhale here, shrug your shoulders. As you exhale, allow your shoulders to release, and finding your sitting bones, introducing just some small vibrational movements to wiggle, allow the wiggles to get even more quick, and inhale, stop wiggling, and exhale. I find that a really good way just to enliven the body and feel, so you can feel connected before we begin the next activity. So what you'll need to do for this exercise is to stand. So you're going to need a wall, and you're going to be perpendicular to the wall so that you are right angles to the wall. I'm going to illustrate using my right hand. So this is for a problem with your right side. If it's a unilateral problem, you can do this exercise on both sides if you want to work into both shoulders. You need to take your hand and spread your fingers as wide as possible. You are going to connect your palm to the wall. What's the important area to consider is the base of the wrist must make a clean and firm contact with the wall. This is the really important part. You might want to connect your wrist first, and your hand is at shoulder height, if you can see that. And then you spread your fingers wide. Now that already may start to produce a response in your forearm here, the flexors of the forearm, anywhere in your bicep or anywhere in the front of your shoulder. You want to try and spread your fingers wide. What you may find is that your fingers might start to buckle. So just make your fingers more narrow, but at least you can have a connection, a good connection, and your fingers are flat. So that's the important bit. You can then work more deeply and widen the fingers as you begin to tolerate the exercise more or work more deeply. You've made your connection, your fingers as wide as they're able to. The next thing that you are thinking about is your elbow. So you're going to just gently break your elbow. Your body isn't rotated towards the wall. I understand you might want to look at your hand, but when you're performing the exercise, you look straight ahead. So there is a clean intersection between your body, a right angle, and the wall. The exercise is this. You bend the elbow as you inhale. As you exhale, you begin to straighten the elbow and push the heel deeper or further into the wall. Let's do that again. Inhale. And slowly as you exhale, you straighten the elbow. Now, some of you may not get the elbow straight and you already may start feeling tension anywhere in the hand, the palm, the forearm, or the arm. This is common, and this is where perhaps anywhere along that line you should experience that tension. Some of you may also experience tension at the top of your shoulder. If that becomes unbearable, you might want to just drop your hand a little bit and then work your way to shoulder height. So, what you'll do, inhale, bend, exhale, connect and push in the heel of the hand into the wall. Inhale, exhale and push into the heel of the wall. You might want to think about inhaling here. As you exhale, you visualize exhaling through the arm to connect to the base of the wrist. You want to warm up perhaps with 5 repeated movements. Breathe in as I've described. And then on your 6th one, you may want to stay here. And you may want to hold this position for 5 breaths. As you inhale with the elbows straight, inhale. Visualize opening the chest. As you exhale, you are exhaling through to connect the base of the wrist to the wall. Inhale. Visualizing opening the chest. As you exhale, with the elbow straight, you exhale through the wrist. That may be enough for some of you. That may already bring up some strong sensations of pins and needles, maybe coldness in the hand. This is absolutely normal. Don't worry about it. There may be some occlusion of blood vessels. There may be some restriction in the interfaces between the connective tissue and the nerve tissue. What will tend to happen is that you shake it out, move the shoulder, and those sensations will subside. Remember to pay close attention to what feels tolerable for you. We're not really aggravating, overstimulating the system. If you feel those sensations are strong, absolutely stop. Wait. Maybe 5 movements are enough for you. Maybe you do 3. Maybe you can only tolerate holding it for 3 breaths or 2 breaths. Understand that all of those options are right, and that you must work with where you are. So what we're going to do, and what's interesting about this exercise, is that again, as you have been following me, the detail is really important. So we're going to use our index finger as the marker to mark the cardinal points. These are positions that the index finger will assume. This is north. We're going to do exactly the same thing and turn the hand towards, this will be my west. Same principle. Connect the base of the hand. Spread the fingers as wide as you're able. If it's too strong, then just close the hand. But the important thing is the wrist. Again, do a repeated movement, as many as you feel able with your breath, and hold. Making the fingers, wiggling your fingers if you're able to. This is also a way to make sure that you're not gripping. That will get easier as you find these positions much more tolerable and they are less restrictive. When you've done that, you may want to rest your hands. You may want to do them all together. It really depends on how your body is responding. Now, as you begin to turn the hand towards the other cardinal point, it will be east in this moment, you will begin to find the sensations increase and they get stronger. So do this with care. Again, same principle. And I'm just going to move you through now to sat. Now this becomes much more difficult. So you're moving the hand outwards. You're moving the fingers behind you. Now notice what I'm doing with my shoulder. I'll just turn here. My shoulder's going outwards. Now this really works in the same direction and with the same intention that you want the shoulders to be more open, and that helps you to lift the chest. So working towards south, most commonly, is the most tricky of the positions to assume. Not all the time, but in 90% of the clients that use this, and even in my experience, it is the most tricky. I have a chronic problem with my shoulder, and this exercise is really helpful and is still quite strong. So what you will find in this position, you may want to, because it's so strong, you'll find it difficult to connect. You may want to start with the hand lower down. So you may want to start with the hand lower down. If you don't get to the south position and you get to southeast, that's absolutely fine. You are working towards deepening maneuvers and allowing slowly the tissue to accommodate incrementally. So if you are at southeast, it's not a problem. If you can't get past east, not a problem. Same principle, working here. This is advanced. If you are bending the elbow at this point and straightening the elbow, bending the elbow and straightening the elbow, you need quite a lot of flexibility for the wrist and the shoulder and the whole complex. This exercise is brilliant for, as I said, not only to help with the shoulders posturally, but also if you're experiencing any work-related upper limb issues in the forearm, flexors of the forearm into the hand. This is a great advanced exercise to carry out that will also help to address those issues. Please get in contact. Andrea from Integra Therapy, Andrea@integratherapy.co.uk. If you have any questions, if you're not sure, please get in touch. Happy to go through some of those ideas and see how this or any other exercise may benefit you. Leave a comment, share your experience if that feels comfortable, and I'll see you again next time. Be well, take care, and bye for now.